A doctor at the University of Utah shares the same sentiment tonight, saying that coronavirus cases are putting a strain on its hospital staff and intensive care unit. He says there's a simple solution, though, but not everyone wants to follow suit. ABC4's Brittany Johnson has the story tonight.
Looking at the past 7 days, the number of hospitalizations has averaged slightly above 211 per day, a number Dr. Russell Vinnick says is concerning.
When we look at especially ICU utilization, we have very few beds left in the state. Even at the University of Utah, we had to open a surge ICU unit.
When the surge unit first opened about 6 weeks ago, the hospital only had non-ICU patients. About 2 weeks ago, it opened up the ICU side. It means staff members are having to pick up extra shifts, which the chief medical operations officer says is not ideal.
Nobody wants to be hospitalized and have a doctor or a nurse who is physically and mentally exhausted caring for them.
To alleviate strain on Utah's hospitals, Dr. Vinnick says a statewide mask mandate is a step in the right direction.
I believe it would help. We've certainly seen that Salt Lake County has improved. We can't say for certain that it was due to the mandate, but the timing is consistent with the mandate.
If a COVID-19 surge happens in Utah, doctors may have to choose who survives. It's part of the Crisis Standards of Care guidelines, using a patient prioritization tool with caution. Back in March, ABC4 News spoke with the president and CEO of the Utah Hospital Association about this situation. He hopes it will not get to that point.
If we do need to start making triage decisions, it would be under an order of the governor or some health authority.
Reporting in the newsroom, I'm Brittany Johnson, ABC4 News.